Ever wondered what HIV/AIDS really is and how it impacts the human body? Human immunodeficiency virus, or HIV, is a virus that targets the immune system, specifically the T cells that help the body fight off infections. If left untreated, HIV can reduce the number of these cells, making the body more prone to infections and diseases. This advanced stage of HIV infection is known as acquired immunodeficiency syndrome, or AIDS. So now that we know what HIV/AIDS is, let's delve into how it's caused and transmitted. How does one contract HIV? What causes it? HIV, or human immunodeficiency virus, is primarily transmitted through certain specific activities. Unprotected sex is one of the most common routes where the virus can cross from an infected person to another through mucous membranes. Sharing needles, often seen in intravenous drug use, can also lead to the transmission of HIV. Another avenue is from mother to child, either during pregnancy, childbirth, or breastfeeding. This is why prenatal screening and anti-retroviral treatments for pregnant women are vital. Lastly, blood transfusions or organ transplants from an infected person can also transmit HIV. However, it's crucial to note that modern screening processes have significantly reduced this risk. It's important to understand that HIV isn't transmitted through casual contact, such as hugging, shaking hands, or sharing food. Knowing how HIV is transmitted helps us understand how to prevent it. But first, how do we know if someone has HIV? What are the signs that someone might have HIV? How is it diagnosed? Early HIV infection often presents as flu-like symptoms such as fever, sore throat, and fatigue. However, these symptoms can be easily mistaken for other illnesses. As the virus progresses, it can lead to more severe symptoms, like unexplained weight loss, persistent diarrhea, night sweats, and opportunistic infections. This stage is often referred to as AIDS, the final stage of the disease. Regular HIV testing is crucial because early detection allows for immediate treatment, which can slow the disease's progression. There are three main types of HIV tests: antibody tests, antigen antibody tests, and nucleic acid tests. Each of these tests has its strengths and limitations, but all can effectively detect the virus. HIV testing can be done in a healthcare provider's office, a testing center, or at home with a self-test kit. Remember, knowing your status is the first step towards managing the disease. Once diagnosed, what's the next step? Treatment. While there's no cure for HIV, it can be managed. But how? Let's delve right into it. Management of HIV primarily revolves around anti-retroviral therapy, or ART. This therapy involves a combination of medications that work together to slow the progression of the virus. By reducing the viral load, the immune system is given a fighting chance to recover and protect the body against infections. But treatment isn't solely about popping pills. Adherence to the prescribed medication is crucial. This means taking the medication exactly as directed by your healthcare provider without missing doses. Irregularities can lead to the virus becoming resistant to the medication, making treatment less effective. Moreover, regular medical checkups are essential. These checkups provide an opportunity to monitor the progression of the disease, adjust treatment as necessary, and handle any side effects of the medication. With the right medication and care, people with HIV can lead healthy lives. Speaking of medication, here are the top 10. Medication plays a key role in managing HIV. Here are the top 10. Anti-retroviral therapy, or ART, is the cornerstone of HIV treatment. It includes powerful medications like tenofovir, emtricitabine, and efavirenz. But it doesn't stop there. Raltegravir, dolutegravir, ritonavir, atazanavir, darunavir, lamivudine, and abacavir round out the list, each with its unique role in controlling the virus. These medications, when combined, form a potent regimen that keeps HIV in check. Living with HIV necessitates a few adjustments. Let's explore some tips and strategies. Living with HIV is not a death sentence. Here are some tips and strategies. With regards to maintaining physical health, it's crucial to adhere to your prescribed anti-retroviral therapy, regularly attend your medical appointments, and strive for a nutritious, balanced diet coupled with regular exercise. For mental health, consider seeking support from a psychologist or counselor to help navigate the emotional aspects of living with HIV. Mindfulness exercises and activities that bring joy can also be beneficial. Social support is another key element. Reach out to friends, family, or join support groups with others who understand your experiences. Finally, addressing stigma is a significant part of living with HIV. Remember, having HIV does not define you. Stand strong against discrimination and educate others about the condition when you feel comfortable doing so. These strategies, combined with preventive measures, can help manage HIV.